Tafuma kumombe Tisevana vakwambe Tafumila mombela Isendisevana vakwambelwa Mombe 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 Mombe.
But it, yo, guys said you wanna fight me and you, bro, that's a mismatch, we cannot box. Peace signs past the matchbox, I live a lead life. Gee, what you thought? Show up in the crap, you then with some hip-hop. Burn the whole house down, with you in it.
Hey yo, Courtney Paul, is that you on the decks?
Bongo mtoto, bongo la zigo. Na mimi shoti cause napenda indoto. Sitoi boko, na mimi yuko soko.
Malawian tell me the lie. Girl, I've been times must have your bad eyes. Yeah, you, I'm me, you. Let me long on the back. Take off my kids for you, treat me, I treat for you, treat right. Make me dance on. Take off my kids for you, treat me, I treat for you, treat right. Make me dance on. I feel I did you wrong. Tell me why I think it's wrong. It's peace, not I want to let you know.
Baby, cool the temper. Baby, know the days. Girl, you make me mental.
Moyo music.
Health experts calling it a pandemic, an economic crisis, a 21-day lockdown, shutdown, social distance, a pandemic.
The word is go loco. Where are we going? Yeah, just lost one on the block. The word is screaming one holiday. Be safe. Wash your hands. Wash your hands. Be safe. Wash your hands. Wash your hands. Block. Be safe on the block. I'm on the block. I'm on the block. I am a block. Be safe on the block.
Social distancing. Tikamagwela min ba si zamagani zinde di fa di tikumvese sama business si onsaima nje kashi kusowa zosaenda nje koma city lola zosalenda nje pangofunika kumvesela malangizo azao moyo ndiyabunge heti deke zopita kugulu zitileke tiseve miyoyo yanza tuneti cheke ngati FIFA komanso kubanika kukosomola komanso chifine chati hita 54747 chipatala chabafoni nchimanage chikumaweka 24/7 ndizotheka kuthana ndizikorona zimene.
Be safe. Wash your hands. Wash your hands. Be safe. Wash your hands. Wash your hands. Block. Be safe on the block. I'm on the block. I'm on the block. I am a block. Be safe on the block.
How has it been on the front line for you dealing with COVID-19 now?
Because it's a challenge, because it has come and we will stay with it.
With yourself, what's the one thing that you are worried about the most with the escalation of cases?
Worried especially for the elder people and those with chronic conditions, because they are the ones affected most and they are the ones who are dying. And you are worried maybe I'm the next person who is going to get diagnosed with COVID-19. That's my main worry.
you were talking about you do work around ARTs as well, who I would assume are also a more vulnerable group.
Yes.
What advice would you give to people who are more vulnerable?
Yes, yeah. As things came at first, we were all scared about catching the coronavirus. But now, with the situation as it is increasing every day, but all that we to accept the situation, and we try all our best that we protect ourselves as well as protecting our patients. We make sure that we wash the hands and then we have a mask.
Maybe just as a final sign-off, if there's any other health workers, your colleagues that you'd like to mention who are also doing commendable work?
As a team, there are a number of areas, right away from the ground labor, whoever is taking part in the hospital setting.
I cannot mention a specific person that I commend this one, but I commend all the health workers and all the support staff, starting from the guards, because they're the ones who are checking the temperature of the patients who come in and go, even the guardians, the people at the reception, the administration, the nurses, the patient attendants. I also just want to commend our management, because they are in this coronavirus pandemic, they are always there for us. When we go with our problems, they try to solve according to their capacity. This virus is transmitted mainly, as we know, through contact. So if we maintain social distance, at least we minimize the transmission of the disease to each other.
Okay, make sure you always put on a mask wherever you go, and don't touch your face, because the virus can be transmitted from your hands. And I plead with the government. As health personnel, we don't have enough PPEs, so we ask if you can provide us with more PPEs and more testing kits. It's frustrating that we send a patient to be tested for COVID-19, but they phone you back saying that have not been tested, there are no testing kits. So help us in those lines. Thank you.
Koka kunja miyala titaunjika tinalivo konzeka.
We're living in that kind of time, right? Because COVID-19 has made life a little bit more complicated. I know you might be a little bit busy that you can see the needs that are around you. And you know what happens when a stranger takes care of you? It changes your life.
Pokerani to Kukaya.
One love, peace, harmony, what you want.
The town Pokerani to Kukaya.
Feel free, calming in a Kanban, big joint, yeah.
Town Pokerani to Kukaya.
One love, peace, harmony, what you want.
Town Pokerani to Kukaya.
Feel free, calming in a Kanban, big joint, yeah.